her. Because we have observed that for quite a while, we usually screen ladies between 24 to 28 weeks of pregnancy for gestational diabetes. Now, this is different than a person coming into the pregnancy with diabetes. Right. So, gestational diabetes causes a persistently elevation of glucose in the bloodstream levels. Why is that important? The baby itself is not diabetic, and so if it's living in a hyperglycemic milieu, then its body is going to try and compensate for all that extra glucose that's around it. And when a baby is trying to do that, in addition to doing its normal developments, some babies can get into trouble with that. We've recognized that, and this is why we do the screening at 24 to 28 weeks of pregnancy. Mm-hmm. The screening is generally performed by giving a test load of a glucose solution that you drink, this sweet, syrupy, typically orange drink. And then an hour after, the blood is taken to see how your body responded to that glucose challenge. That first test is a screen of 50 grams of a glucose solution. One of the inconsistent and confusing aspects of this test is that some women go into it in a fasting state and some don't. The genesis and the history and the purpose of this screening test, the initial 50-gram 1-hour glucola, is to really assess your body in its natural state. So I tend to tell my patients this. It's sort of like, you know, you have a test coming up and you're preparing for the test, but this is not the test you want to prepare for, because if you start cutting back on your usual habits and you go and you take this test in a fasting state and you get a number that looks good, and then a few days later you've gone back to your old routines, guess what? We are going to miss that opportunity to diagnose gestational diabetes because you've kind of prepared for the test. We don't want you to prepare for the test. We want to see you in your natural state. If the number does not come back okay, then there is another test that we will do to actually diagnose if you have gestational diabetes or not. So the 50 gram is just let's just check to see if you're a person who we need to be concerned about. And then the 3-hour test is, okay, let's actually make the diagnosis. Women who have particular risk factors, if they had a prior pregnancy with GDM, gestational diabetes, if they had a prior pregnancy for which they delivered a 9.5 pounder, and if they have a family history of diabetes, if they have hypertension or any kind of cardiovascular disease, those are women who should be screened. Now, for women who have polycystic ovarian disease or polycystic ovarian syndrome or PCOS, you ladies should have an early 1-hour screen, because PCOS is associated with insulin resistance even outside of pregnancy. And we want to have that opportunity to treat any abnormal numbers before things get out of control. There are also certain ethnicities or African American ladies or AAPI ladies or Latino ladies. There's just a genetic predisposition for that. So especially if you're kind of struggling with weight, We all are in some form or fashion. But if you know that your BMI is kind of over 40 and you have these risk factors, please ask your provider or your doctor to screen you very early in the pregnancy, usually at the first prenatal visit, and for gestational diabetes, and then screen again at 28 weeks. So let's say that you have diabetes in the pregnancy called gestational diabetes. After you've delivered, the American College of OBGYN, they do recommend that you get screened after delivery, somewhere between 4 to 12 weeks after delivery, for persistence of diabetes, meaning the diabetes did not resolve after the end of the pregnancy. That is the definition of gestational diabetes. It comes during pregnancy, it goes away. But if it doesn't, then it's a good idea to get screened afterwards so that we can identify you as that person that would need periodic follow-up with your primary care doctor for a long time. Because we do know that the babies can often be a crystal ball into what your future is going to be like. So you may be healthy now, have gestational diabetes. You may or may not have family history, but maybe in 10 years, your risk for diabetes is 50 to 75% increased. So I would advise that we take the information seriously enough to not like forget about it after the baby is born, but just kind of put it in the list of, when I go to the doctor, this is something we should be checking once or twice a year. So we might not be able to avoid gestational diabetes, but there are some things that we can do. The standard American diet does not take into consideration portion control. Portion control can be very liberating, and I can attest to that. Even in my gray age, I am learning how to portion control. I am from Jamaica, and when we put down a plate of food, it's a plate of food. But when you look at that rice, the amount of rice that you get when you go to that store, that Jamaican food store or wherever you go, that is the equivalent of about 4 portion sizes. Yeah, who knew? So you can have what you like, but just be very mindful of portion control. Try and avoid junk food, things with corn fructose syrup, things that are packaged, because things that are packaged are made to last on a shelf until the zombie apocalypse happens, and it is still good in those times. Probably not a good idea to make a habit of eating all the time. Increasing your protein can actually balance your average glucose levels out. And if you are exercising, we prefer for you to exercise before pregnancy, not during pregnancy, because we don't want to surprise your heart. So if you've not been physically active and you're pregnant, now is not the time to start exercising. However, if you've been an exerciser, you've been doing your thing, continue doing your thing. Because here is the deal with exercise and weight. Exercise makes your cardiovascular fitness better. And by the way, afterwards, you get a nice benefit of some weight loss. So we're not exercising to lose weight. We're exercising to be healthier. So that is it, my dear, for screening of gestational diabetes. Don't forget, you don't have to fast. And if you go to any of the major labs, it's on their website. It also says you don't have to fast. So if when you go for the test, they're asking you if you're fast, just say, check your website. It's not a fasting test. This is only for the 1 hour glucola. All right, my loves. So again, this is Dr. Heather Stanley-Christian from Unity MFM, wishing you all the best that Hump Day Wednesday has to offer. Let's try and walk good. Let's leave the concerns that we can't control right there. and just worry about the things that we can change. If you have any questions or concerns, or you just want to reach out to me, our handle is at UnityMFM. You can check us out at Insta. Everything is listed right there. And I want to tell you, walk good. Bye.